Hello, I am Tricia Young, a Doctor of Nursing Practice or DNP candidate at Gonzaga University with 26 years of nursing experience. I hold a Master of Science in Nursing with a public health specialization and a Master of Science in Forensic Psychology. As part of a scholarly quality improvement DNP project, I have developed this education designed to support your mental well-being. You should have received an information sheet regarding the project and surveys via email from the Wellness Officer, Phil Bassett. The surveys are the Operational Police Stress Questionnaire, or PSQ-OP, designed to assess your stress, a demographic survey, and a binary response survey that will assess your knowledge and use of departmental mental health resources and mindfulness techniques. You should choose a unique identifier from the two choices provided on the initial survey. Before starting the program, please complete the surveys using the confidential and secure link. The survey responses are confidential, de-identified, and returned directly to me. You will be asked to complete the PSQ-OP and binary response surveys again 1 month after the program. Please remember the unique identifier that you used on the first surveys. Over the next 6 weeks, including today, your wellness officer will email you a brief educational video each Monday. These videos will provide valuable insights and practical techniques for managing stress in your demanding profession. This project was designed to impact your stress levels and enhance your knowledge of mental health and knowledge and use of available resources and mindfulness techniques. Thank you for participating in this vital program. Your well-being matters. After this video, you should be able to define mental health, stress, and trauma, identify the key parts of the brain that respond to stress and trauma, explain how stress and trauma impact the brain's function and contribute to common mental health challenges in law enforcement, recognize the signs and symptoms of common mental health conditions, identify the departmental mental health resources available to support officer well-being, understand the role of mindfulness in reducing stress in police officers, and demonstrate the basics of mindful speaking to enhance communication and emotional regulation in high-stress situations. If you are participating in the program and need additional mental health support, please know that resources are available to help. If you or someone you know is in immediate distress, the 24-hour crisis hotline, which is 988, is always available for confidential support. During the program, these mental health resources consist of dedicated counselors here to provide professional help and guidance, nutritional education and support, and crisis assistance and coaching. Additionally, the peer support team is ready to offer understanding and assistance from colleagues who truly understand the challenges of law enforcement. You are never alone. Help is here when you need it. Mental health refers to overall well-being, enabling individuals to manage stress, use their abilities effectively, and engage productively within their communities. It exists on a continuum influenced by genetics, environment, resilience, and chronic stress, rather than being defined solely by the presence or absence of mental illness. Stable mental health supports productivity, focus, and resilience, contributing to a higher quality of life. Stress is the body's psychological and physiological responses to internal or external pressures and trauma, affecting emotions and behaviors. While eustress, or positive stress, can enhance focus and motivation, distress has harmful psychological and physiological effects. You, as police officers, often experience chronic distress from repeated exposure to trauma and occupational stressors, such as leadership challenges, peer conflicts, and demanding shift work, which can negatively impact your mental health. Trauma is an intense emotional response to distressing events such as violent crimes, accidents, disasters, or abuse. Repeated exposure to traumatic incidents can lead to lasting psychological and physical effects, increasing the risk of post-traumatic stress disorder, or PTSD, anxiety, depression, and substance use disorders. You, as police officers, frequently witness violent deaths, life-threatening situations, and tragedies involving children, further compounding your trauma risk. In a study of 408 police officers, 98% reported exposure to multiple traumatic events, and 44% experienced PTSD symptoms. A significant relationship was found between trauma exposure and PTSD symptoms. By understanding the effects of stress and trauma, you can take proactive steps to guard your mental health and seek support when needed. The brain is the central organ of the nervous system, responsible for controlling thoughts, emotions, memory, movement, and bodily functions. It comprises billions of neurons communicating through electrical and chemical signals, allowing for complex cognitive processes and coordination of the body's activities. The key parts of the brain are the cerebrum, which is the brain's largest part, responsible for reasoning, emotions, problem solving, voluntary movements, and sensory processing. The cerebellum, which controls balance, coordination, and fine motor skills. The brain stem, which regulates essential life functions like breathing, heart rate, and digestion. And the limbic system, which includes structures like the amygdala and hippocampus, which manage emotions, motivations, and memory. We will discuss the amygdala, the hippocampus, and the prefrontal cortex, which are highly involved in the stress and trauma responses. The brain is highly adaptable and can reorganize itself in response to learning, injury, or environmental changes, which is a phenomenon called neuroplasticity. Different parts of the brain respond to physical and psychological stressors and trauma. We will focus on what parts of the brain are involved in psychological stress and trauma responses and how they are affected. The brain's responses to psychological stress and trauma involves a complex interplay among the prefrontal cortex, or PFC, the amygdala, the hypothalamus, and the hippocampus. The PFC, responsible for executive functions like decision-making and emotional regulation, evaluates stressors and modulates our reactions to them. Upon perceiving a threat, the PFC communicates with the amygdala, which is the brain's fear center, which triggers the fight, flight, or freeze response. The amygdala communicates the perceived threat to the hypothalamus, which activates the sympathetic nervous system, or the body's gas pedal, and communicates to the rest of the body, causing the release of stress hormones such as cortisol and adrenaline. The activation of the sympathetic nervous system and the release of stress hormones causes breathing, heart rate, and blood pressure to increase, and causes widening of the airways in the lungs and the release of glucose, which is blood sugar, into the bloodstream for energy. Extra oxygen is sent to the brain, increasing sensory perceptions. The hippocampus, essential for memory formation, helps contextualize the threat by retrieving relevant or similar memories, influencing the overall stress response. The body is then ready to fight or flee or freeze. The hypothalamus works to activate the pituitary and adrenal glands, which is called the hypothalamic pituitary adrenal axis, or HPA, and that keeps the gas pedal to the metal as the stressor continues, activating complex neurological and hormonal systems which keep the body ready to respond to the threat, and cortisol levels are elevated. Chronic stress profoundly affects these key brain regions, leading to significant mental health implications. Chronic stress impairs the PFC's structure and function, which weakens connectivity and increases vulnerability to mental health disorders. Chronic stress can cause enlargement in the amygdala, which is the brain region responsible for processing emotions such as fear and anxiety. And this structural change may result in heightened emotional responses and increased baseline anxiety levels, contributing to the development of stress-related mental health disorders such as generalized anxiety disorder or substance use disorders. When a person experiences stress, the hypothalamus releases hormones, signaling the pituitary gland to secrete more hormones that prompt the adrenal gland to produce cortisol, which help the body manage the stress at the time. Chronic stress significantly impacts the hypothalamus, causing it to become dysregulated, leading to consistently elevated cortisol levels, which increases the risk of anxiety, depression, memory, and concentration impairments. Chronic stress inhibits neuron growth in the hippocampus, leading to neuronal atrophy. This structural change impairs learning and memory functions and can contribute to the development of mental health disorders such as depression and anxiety. Chronic stress can impair the functioning of these regions, leading to heightened emotional reactions, hypervigilance, and difficulties in memory, decision-making, and focus. Understanding these neural mechanisms underscores the importance of stress management interventions to mitigate the adverse effects of chronic stress and repeated trauma exposure on mental health. Common mental health issues you face as police officers due to chronic stress and repeated trauma exposure are PTSD, generalized anxiety disorder, and depression. Substance misuse leading to substance use disorders can be a co-occurring condition related to PTSD, depression, and anxiety, with a prevalence of as high as 30% among first responders. Recognizing and addressing chronic stress is crucial for maintaining mental well-being and preventing long-term neurological and psychological consequences. So some causes of PTSD are exposure to traumatic events such as combat and military experiences, physical or sexual assault, natural disasters, serious accidents, childhood abuse or neglect, or prolonged or repeated trauma, which increases the risk of developing PTSD. And in your case, being first responders, you do have prolonged or repeated exposure to stress and trauma. Genetic and neurobiological factors may also contribute to susceptibility to PTSD. Signs and symptoms include re-experiencing symptoms such as flashbacks, nightmares, and intrusive thoughts, avoidance or avoiding reminders of the trauma and emotional numbness, negative changes in mood and cognition, guilt, shame, difficulty remembering aspects of the trauma, or hyperarousal, which would be irritability, difficulty sleeping, and exaggerated startle responses. Generalized anxiety disorder is another common occurrence among police officers and can be a consequence of repeated stress and trauma exposure. Biological factors include an imbalance in neurotransmitters such as serotonin or norepinephrine in the brain, genetic predispositions or family histories of anxiety or mood disorders, and environmental and psychological factors such as chronic stress or traumatic life events, overprotective or critical parenting styles, and excessive worry as a learned behavior. Some signs and symptoms of generalized anxiety disorder are excessive, uncontrollable worry about daily activities such as work, health, or finances, physical symptoms of muscle tension, fatigue, restlessness, difficulty sleeping, and cognitive and emotional symptoms of irritability, difficulty concentrating, and feeling on edge. There may be avoidance of anxiety-provoking situations such as social situations, and seeking excessive reassurance or validation. Depression is another mental health impact of stress and trauma. And it can be caused by a number of things as well, such as an imbalance in the neurotransmitters of serotonin, dopamine, and norepinephrine, hormonal changes such as the cortisol dysregulation, genetic risk factors, family history of depression or mood disorders, and the environmental and psychological factors of chronic stress, trauma, and adverse childhood experiences. Social isolation, major life changes or loss can contribute as well to the development of depression. Signs and symptoms of depression include emotional symptoms such as persistent sadness, hopelessness, and irritability, difficulty concentrating, indecisiveness, and negative self-thoughts, fatigue, sleep disturbances, appetite changes, and withdrawal from activities, social isolations, and sometimes suicidal thoughts. Causes of substance use disorder can include biological factors such as neurotransmitter imbalances, for example, dopamine, or a dysfunction in the reward system. There could be a genetic predisposition to impulsivity or addiction. Psychological factors include using substances as a coping mechanism for stress, anxiety, depression, or trauma, poor impulse control and risk-taking behaviors, and environmental and social factors such as peer pressure, family influence, or cultural acceptance of substance use, along with easy access to substances and lack of social support. Also, a history of adverse childhood experiences and chronic stress and trauma exposure. Signs and symptoms of substance abuse disorder include behavioral symptoms of occasional binge use or increased frequency of use, using substances in risky situations such as before driving, neglecting responsibilities, or experiencing conflicts due to use, and some physical symptoms such as changes in energy levels, weight, or sleep patterns. Short-term withdrawal symptoms could be headache and irritability, and psychological symptoms of mood swings, increased stress or anxiety after use, or rationalizing or minimizing the extent of the substance use. Seeking mental health support as a police officer is crucial for maintaining both personal well-being and professional effectiveness. Law enforcement personnel are routinely exposed to high-stress situations, traumatic events, and life-threatening encounters, all of which can take a significant toll on mental health. Left unaddressed, stress, PTSD, anxiety, depression, and substance abuse can impair decision-making, job performance, and relationships, leading to burnout and even suicidal thoughts. Prioritizing mental health through mental health resources, counseling, peer support, and mindfulness practices addresses stress and fosters a healthier work environment. By breaking the stigma around seeking help, you can protect your own well-being and set a positive example for your colleagues, ultimately strengthening the entire law enforcement community. Here are the resources offered by your department. You have a licensed mental health counselor, you have access to peer support officers, and access to law enforcement coaching, which is a network of peer supporters. You have access to the Cortico Wellness app, which is a smartphone app that provides resources and information to first responders regarding mental health. You have an employee assistance program through Human Resources, and there is a wellness room located on the first floor of the police department, and it offers a quiet place to sit and practice mindfulness or gather your thoughts. Mindfulness is an ancient practice that originated in Buddhism. It is a non-judgmental, present moment awareness that can be developed through practice, improving psychological flexibility, concentration, focus, and stress levels. Mindfulness techniques decrease stress through a purposeful, systematic focus on the mind and body to restore calm and promote emotional balance. These techniques are regularly used by police officers. Mindfulness-based interventions have effectively reduced stress and related symptoms such as anxiety and depression among police officers. Mindfulness-based stress reduction techniques activate the prefrontal cortex and have improved physiological regulation of the HPA axis activity, which, as you remember, is responsible for cortisol, the stress hormone. Research indicates that individuals with a greater capacity for present moment awareness experience lower emotional distress and reduced autonomic reactivity, such as heart rate fluctuations, even in stressful conditions. Studies further demonstrate that mindfulness training enhances blood flow in the amygdala, remember the fear center of the brain, and the hippocampus, areas of the brain affected by stress and trauma, ultimately affecting mood regulation. Mindfulness techniques can be conveniently, quickly, and privately used to improve job-related stress experienced by police officers. Mindfulness techniques such as practicing a kind and compassionate attitude have been shown to decrease job-related stress and distress in police officers. Mindfulness practices that focus the mind on sensations, objects, thoughts, body parts, breathing, body scanning, and mindful listening have significantly impacted job-related burnout, depression, and anxiety. The use of mindfulness-based stress reduction showed an 80% reduction in perceived stress among police officers who attended an 8-week program. The first mindfulness technique I want to introduce you to in this program is mindful speaking. Mindful speaking engages your prefrontal cortex, and it means communicating with awareness, intention, and emotional control. So before you speak, pause, take a breath, and a moment to reflect on why you are responding the way you plan on responding to someone during a conversation. Is your response coming from an angry place or a place of kindness, patience, and understanding of the other person? Are you gossiping? Are you interrupting? Are you trying to avoid silence? Make sure you are listening intently to the other person before responding. Speak carefully and clearly. Observe how you feel during the conversation. Are you frustrated, angry, happy, or sad? You can bring mindfulness into your communication to speak purposefully and clearly. As you become more mindful in your conversations, make a mental note of how it feels, especially if you understood someone better or felt understood and heard. Practice mindful speaking with your family, friends, leadership, the community, and peers. Mindful speaking may be difficult in some of your encounters with the public, but not all of them. So practice as often and as safely as you can. Thank you for participating in this week's video. Let's remember some key points are the key brain regions that are involved in stress and trauma, which are the prefrontal cortex, responsible for impulse control and decision making, which is weakened by chronic stress. The amygdala, which is the fear center and is overactive in trauma, leading to hypervigilance and anxiety. The hippocampus, which is responsible for memory processing, which can be made smaller by stress and causes flashbacks and memory issues. The hypothalamus, which regulates the stress response, and chronic activation can lead to elevated cortisol levels and anxiety, burnout, and chronic stress. Chronic stress causes impaired emotional regulation, hypervigilance, and anxiety, memory impairment, and increased risk of mental health disorders. Common mental health disorders among police officers are PTSD, depression, anxiety, and substance misuse. And our mindfulness technique for the week was mindful speaking. So we want to pause before responding, actively listen, think about our response, and speak clearly and note how you felt during this process. These actions activate the prefrontal cortex to help you engage in rational thinking and reduce reactivity. And I challenge you to practice mindful speaking with your family, friends, and peers, and the public as you can safely. And note the changes you experience using mindful speaking. Please think about the mental health resources available to you and consider using at least one of them this week. Next Monday's mindfulness technique is mindful, or also known as box or tactical breathing. Please feel free to contact me through email with questions and comments. I am happy to respond or schedule a time to talk with you. Thank you so much for watching, and I will see you next week.